As a lawyer that negotiates physician contracts, I have the opportunity to talk to physicians across specialty. And this week, I was having conversations with two emergency medicine physicians, and the topic of RVUs came up. As you may know, in the emergency medicine space, most emergency medicine physicians are paid hourly. However, there are some employers that are really pushing the RVU metric, where you would earn a lower base hourly rate for the day or the night, maybe somewhere in the 150s, 120s, versus the typical $250, $220 an hour. But to supplement that lower hourly rate, there is an RVU bonus component to their compensation. In talking about this RVU compensation component with these physicians, there were two key things that really stuck out to me that I think any emergency medicine physician should be very cautious of whenever considering a contract where there is a lower hourly rate and an RVU compensation component. And those two considerations are, first, the kind of facility that you will be providing those services for, and two, the pool rate. So let's first talk about the facility. There are a lot of things that happen in the emergency department that are beyond a physician's control. Whether your orders come back on time, whether you're working the night shift and things really slow down, whether your images are read on time, whether there are enough nurses staffed in order for you to use all of the rooms that are available in the department. Anytime those things are out of whack, it can really slow down or hinder your ability to earn RVUs. So while a recruiter or a hospital may be talking about the potential of in the upper 200s or $300 per hour, if those components are not managed and moving very well, where nursing staff is not an issue, where orders and images are coming back in a timely manner, or other factors that can slow down an emergency medicine physician in the department, if those things are not under control, you will not be able to earn the RVUs necessary to get those upper limits that kind of convert to 300 or 280 an hour. So the key questions to really kind of talk about whenever someone is talking to you about an RVU rate in the emergency department are to ascertain those factors about that facility. The second component is the pool rate, and many physicians do not know what a pool rate is. A pool rate is the per hour dollar amount that your employer will set aside per hour that emergency medicine physicians, all of you guys, work for that month or that year. Oftentimes that rate is much lower than the rate that they have told you that you could possibly earn. For example, sometimes the pool rate may be set at $200 an hour. Another time I've seen it set at $180 an hour. Sometimes I've seen that pool rate set at $220 an hour. The challenge with that pool rate is if there is one physician in that group that is earning RVUs fast enough and well enough to be in the $300 range, that means someone else is being knocked down to counterbalance that pool rate. So if you have an instance where you have a $190 an hour pool rate for one physician to earn $300 an hour, that means another physician is earning probably $90 or $100 an hour. And if you are that physician stuck on a shift where all your rooms are not open, your orders are not coming back, you can really earn less than had you taken the usual hourly rate that may be in the mid 200s. So anytime an emergency medicine physician is considering whether to take a lower hourly rate that has an RVU component, those are two big things that you have to watch out for. How well that facility is moving things along and what the pool rate is that's going to be set for everyone in that group to ensure that actually getting that higher rate is in fact doable. I hope you enjoy learning about how an emergency medicine physician should consider an RVU rate pay structure and the two important things to consider. If you want to learn more, click the link below and book a consultation.